Hello everyone, welcome to eCenter YouTube channel. In this video, we will discuss scope of pharmacology and role of pharmacology in drug development. So we will discuss scope of pharmacology one by one. So what is meant by scope? Scope means what and how knowledge we can apply and what benefits we get for our discipline life. It is called as a scope. So first scope of pharmacology, it is to study the pathophysiology of the disease and disorder. By application of the knowledge of pharmacology, we can understand the pathophysiology of the disease and disorder. Pathophysiology means the what abnormalities in our normal functioning occurs. It is studied by using the knowledge of pharmacology. Next scope, it is a study of pharmacokinetics. Pharmacokinetics profile include A, D, M, E. A means absorption, D means distribution, M means metabolism, and E for the excretion. In this pharmacokinetic profile, we can study how the absorption, distribution, metabolism, and excretion of the drug is occurred in our body. And when person suffering from special condition or abnormal condition, then how functioning of the drug is takes place in the body. It is studied in the pharmacokinetic profile. Third scope of pharmacology, it is a study of pharmacodynamics. Dynamics means related to the effect of the drug. Pharmacodynamics, it is important than pharmacokinetic. In pharmacodynamic, we study the effects of the drug with unwanted effects of the drug. For example, when patient suffering from the high blood pressure, then doctor prescribe the antihypertensive drugs. But antihypertensive drugs may cause lower the blood pressure than normal blood pressure. This is the unwanted effect of the antihypertensive drugs. Next scope, it is a clinical pharmacology and therapeutics. Clinical pharmacology means study of the drug on point of view of therapeutics. Therapeutic means the what is use of the drug for the patient. It is a clinical pharmacology. In this we can study the use means what purpose of the drug or what treatment can for what treatment drug it is used, it is studied. Next, that is a contraindication. Contraindication means the condition at which drugs not to be taken. For example, when patient suffering from the kidney disorder, then diuretics should not be taken at condition. Next, contraindication, when the person suffering from hepatotoxicity, at that condition non-steroidal anti-inflammatory drugs should not be taken. Next, it is a posology. Posology, it is a branch of pharmacy in which drug calculation calculated based on the patient's age. Next, it is a bioavailability. Bioavailability means the rate and extent of the drug present at systematic circulation. Only 100% bioavailability possible for IV route administration. Next scope, it is a toxicology. Toxicology means study of the poison. So what is meant by poison? Poisons means the substance which affects our normal pathophysiology and may seek you. In toxicology, we study the source, means the poisoning it occurred accidental or intentional. Next it is the symptoms, means after administration of the poisoning or introduction of the poisoning, which symptoms are shown by our body. It is studied in the toxicology. Next, management. Management means the make the patient stable or supply the oxygen. It is a condition to make patient from identification of poisoning till time to patient hospitalized. Next, it is a treatment. For the treatment of the poisoning, antidotes are used. For example, patient suffering from methanol poisoning, then ethanol act as an antidote. For anticoagulant poisoning, coagulant act as an antidote. Next scope, it is a forensic science. Forensic science. In the forensic science, by application of the knowledge of pharmacology, we can investigate the amount of the drug present at the blood and serum level. Next scope, it is a pharmacovigilance. Pharmacovigilance, it is a word combined by two words, that is a pharmacon and vigilance. Pharmacon means the drug and vigilance means forecasting. In the pharmacovigilance, unwanted effects of the drug, it is studied after launching the drug into the market. Next, it is a preclinical study. In preclinical study, selection of the animal for the experiment, it is a difficult task. For that purpose, we can apply the pharmacological knowledge and mechanism of action of drug to identify or choose the animal. For example, to study the antipyretic drugs, we can choose rabbit. Next, that is the clinical trial. For the clinical trial testing, we prefer human beings for the safety and efficacy measurement. For safety measurement, we used healthy volunteers, and for the efficacy measurement, we used the abnormal or diseased person. Next that is a P drug. P drugs, it is a new concept. It is a derived from the pharmacogenetics and the pharmacogenomics. In this scope, we calculate what mg of the drug need for the treatment for the individual. Means it is a different for person to person. Next, it is a role of pharmacology. Role of pharmacology include, first it is the target identification and validation. Coology helps to identify and validate the target which is linked to the diseased condition. Next role, it is a mechanism of action. Pharmacology determines the how drugs binds to the target at cellular, molecular and the systematic level. Next role, it is a pharmacodynamics. Pharmacodynamics studies the relationship between the drug concentration and drug effect on the body. We can predict the efficacy and potential risk of the drug. Next, it is a pharmacokinetic. Pharmacokinetics determines the how drug absorbed, distributed, metabolized and excreted in our body. Next, it is a toxicology. In the toxicology, we can evaluate the potential risk in the preclinical model to ensure the safety in clinical trials. Next, that is a drug optimization. By help of refining the drug, we can develop the drug which improves the specificity, safety and efficacy of the drug. Next, our last role of the pharmacology, it is the personalized drug. In personalized drug, by using the pharmacogenetics and pharmacogenomics, we can develop a drug tailored by individual genetic profile. Like and share this video and subscribe our channel. Thanks for watching.